So I spoke in the educational session at ASCO, and in part of the session was about the practical use of monoclonal antibodies. And the talks before me were really around the ones which are approved, which is daratumumab and elotuzumab, whereas I was looking at what's going to happen in the future. And there's lots of excitement about that because the future antibodies are really embracing the new technology. So they're not just naked antibodies, they're antibodies that have got a drug conjugate attached to them, and so have more of a powerful effect at killing the myeloma cell. But also antibodies that are called bispecifics, so they not only target the myeloma cell, but also target the T cell. And then we spent a little bit of time also discussing other ways of embracing the immune system, so such as CAR T cells. And much of the data I presented was around using a target called BCMA, which is particularly expressed on myeloma cells. And the reason I concentrated on that target is that that's the one with the most drugs which are going to be coming to the clinic in the next year to 2 years. And certainly the data that's been presented both at this meeting as well as at the ASH meeting at the end of 2007 showed that one of the antibodies, which is a BCMA drug conjugate, had responses in end-stage refractory patients of about 60%, which is pretty impressive for a monoclonal antibody. And then the BCMA CAR antibodies, they've had responses in between 80 and 100% of patients and seem to have a median progression-free survival of about a year, which again is incredibly impressive in these end-stage patients who have received all other known therapies. So I think there isn't any data as far as response for the bispecific antibodies. But the general excitement is there for them, particularly given how impressive they've been in the treatment of acute leukemia. So I think the summary of my talk is that we don't just have CD38 as a target or SLAMF7 as a target. There's lots of new targets coming behind, and given the way that technology has improved, those targets and the way that we're going to target them is really going to show great promise in the next year to 2 years.